Well, good afternoon, everyone, and welcome to our daily briefing. I'd like to begin today with a medical update from Dr. Ngozi Ezike.
Good afternoon, everyone. Today, IDPH reports 3,137 new cases of COVID-19 here in Illinois for a total of 56,055 across the state. This unfortunately includes a total of 2,457 deaths, of which 105 were reported since yesterday. To date, we have run 284,688 tests, with 14,821 being performed in the last 24 hours. Regarding hospital data, as of yesterday, 4,900 people were in the hospital with COVID-19. Of those 4,900, 1,263 patients were in the intensive care unit, and 777 patients were on ventilators. Putting on my pediatrician hat, I'd like to remind parents and guardians to make sure that you're staying up to date with your children's vaccinations and their regular checkups. Please check in with your pediatrician or your pediatric provider to learn the guidelines that you need to follow in order to make your visit as safe as possible. In addition to needing to see the doctor when you're sick, these well visits are critical for monitoring growth and development. We assess hearing and vision. We check for lead exposure. So these checkups, as well as the vaccinations that are attendant with those, are very critical. When you are visiting the doctor, please remember to wear your face covering and for your older children as well, so that you can minimize the spread of droplets and aerosols, and others should be doing the same to protect you. And putting on my adult physician hat, I'm asking adults, you need to take care of your health as well. I know many people are taking advantage of telehealth visits, but if your doctor says that you actually need to come in to follow up, either on your high blood pressure or your diabetes, please take the necessary precautions and proceed with your critical doctor's visits as well. We must make sure that we get all the care that we need to keep ourselves as healthy as possible. All of this is important as we continue to stay well, to stay safe, and stay home. Thank you for your attention. Now I'll repeat my comments in Spanish. Buenos tardes y gracias a Gobernador Pritzker por su liderazgo firme. Hoy estamos reportando 3,137 nuevos casos de COVID-19 aquí en Illinois, para un total de 56,055 casos. Esto incluye un total de 2,457 muertes, de las cuales 105 fueron reportados desde ayer. Hasta la fecha hemos realizado un total de 284,688 pruebas para COVID-19, con 14,821 realizadas en las últimas 24 horas. Desde ayer había 4,900 personas en Illinois estaban en el hospital con COVID-19. De ellos, 1,263 pacientes estaban en la unidad de cuidado intensivo y 777 pacientes estaban en ventiladores. Como yo soy pediatra, me gustaría recordar a los padres y familias que se aseguren de estar al día con las vacunas y los chequeos regulares de sus niños. Consulte con su pediatra para obtener instrucciones sobre cómo visitar una oficina en manera segura. Deben ir por sus chequeos y por sus vacunas para ayudarlos con su desarrollo y crecimiento. Eso es muy importante. Si está visitando al médico, use una cubierto facial. Y como yo soy doctora de los adultos también, adultos, usted también deben vigilar su salud. Se necesitan sus chequeos por diabetes, alta presión o algunas condiciones que tiene. Podemos tomar todas las medidas prevenidas en el mundo, pero si descuidamos nuestra salud, todos seremos más susceptibles a contractar COVID-19. Quédanse bien, quédanse seguro y quédanse en casa. Gracias. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. And I want to introduce you all to a new face, as this likely won't be the last time that he joins us for one of our public updates. That's Dr. Wayne Duffus, MD, PhD, a trained epidemic intelligence service officer with the Centers for Disease Control, who has led multiple initiatives within the agency, most recently as a senior medical advisor in the CDC's Division of Global HIV and Tuberculosis. Dr. Duffus has stepped in at IDPH as our acting state epidemiologist and has primary responsibility for our contact tracing initiative. I've talked before about our ability to test and trace and how critical it is as we move from our stay-at-home order towards a new normal. The importance of testing has been a major topic over the last few weeks, including yesterday. So today's focus is on that second T, tracing. Tracing, or contact tracing, is one of the most critical tools that we have to reduce our spread rate, speed up our diagnoses, and seek to halt outbreaks before they happen. But let's start with the basics. What is contact tracing? Well, it means making sure that you get notified if you've had contact with someone who has tested positive for COVID-19. So you can do what's necessary to keep you and your family and your community safe. Contact tracing means we will let people know before symptoms start that they could become ill. In the context of a very infectious virus, this is our primary tool for identifying potential asymptomatic spreaders so that they can self-isolate quickly and slow the spread of the virus to their contacts, keeping more people COVID-free for longer. And that last factor is key because it demonstrates why contact tracing is so important to all of us together. It means a reduced rate of spread, fewer outbreaks, and an all-around healthier Illinois. Contact tracing isn't a new concept. It's been around for many years, and Dr. Duffus will talk a bit more about that history. The difference now is that in order to move safely back toward normalcy, Illinois, the United States, and frankly the whole world must contact trace on a never-before-seen scale. Contact tracing has played a role in our COVID-19 response since the earliest days of this pandemic, as local health departments around the state have aggressively sought out each COVID-positive person to identify all their close contacts and then encouraging those contacts to opt into monitoring programs and to follow recommendations. That was when we had a manageable number of cases and contacts that county health departments' existing staffs could handle. Of course, as we all know, over just the last few weeks, COVID-19 has reached a massive scale of spread statewide and nationwide, and existing public health management infrastructure simply can't keep pace. No doubt, as we all live through this pandemic, I think we'll all have a lot to consider about our failure to invest in public health in this country. But we'll save that conversation for another day. Right now, we have to deal with what's right in front of us, and that's getting to the other side of this crisis. Here in Illinois, we've had more than 50,000 known cases to date, largely in just a 60-day time frame. Their contacts are 50,000 sets of family, friends, coworkers, commuters, classmates, and other contacts. It's an unprecedented public health challenge, so we need an unprecedented solution to meet this moment. To do that, Illinois will be building on our existing infrastructure and expertise to shape a massive statewide contact tracing operation, gradually building over the coming weeks, and then scaling up an army of contact tracers by the hundreds and then by the thousands. Right now, based on our current rates of spread, we're looking at a benchmark that could approach 30 workers per 100,000 residents. But to be clear, that number can and will diminish if we see greater success in our public health measures, particularly our new face covering requirement. Already, we've identified groups of Illinois residents quickly willing to scale and be part of our efforts: undergraduate and graduate students, volunteers, retired health professionals, local health officials, community health workers, and new hires. And if you're interested in being a part of that, keep an eye out for more information on how to get involved in your community in the coming weeks. A significant part of this program involves technology. When an individual tests positive for COVID-19, a contact tracer will reach out to them through an app, through email, a text, or a phone call. And because not everybody can or will use technology, some will require follow-up even with a safe in-person visit if the COVID-positive person can't be reached in some other way. Then step 2. Interviewing the COVID-positive person, asking them to gather their contacts and retrace their steps over the past 14 days. This is what allows us to significantly slow the spread of the virus, because connecting with those who've been exposed allows us to do 3 important things. 1, notify them that they've recently been in proximity of someone who has tested positive. 2, recommend that they seek a test and self-isolate. And 3, offer them resources on how to access any needed assistance to prepare them for self-isolation. Things like alternative housing, food delivery, or medication. Privacy is an important aspect of maintaining trust in contact tracing. So to be clear, contacts will remain anonymous. Looking backward and pointing fingers doesn't help anyone in this situation. It's about what we do next to keep each other as healthy and safe as possible. Remember, we aren't reinventing the wheel here. Contact tracing has been done in every pandemic and major outbreak for many years. In fact, that's why Dr. Duffus is an experienced expert at it. And in a moment, I'll ask him to talk more about our efforts to build out contact tracing in Illinois. Finally, I want to take a moment to recognize a very extraordinary group of people. Today, the Illinois State Police, consisting of the finest troopers in the nation, will be welcoming 92 cadets into their ranks. 92 cadets who completed their training in the midst of a global pandemic will take their oath and join the ranks of our proud Illinois State Police. As these are unusual times, so too is this milestone. For the first time in the 98-year history of the ISP, there will be no graduation to celebrate the completion of their training. For the first time, there will be no class picture, no speeches, no family in the audience proudly watching them as they cross the stage and take their oath. And in the very act of accepting their mission in this way, at this time, these officers, these troopers, are launching their formal careers as members of the Illinois State Police as they will live it, in great service to us all and great sacrifice. When I became governor, I committed to rebuilding the ranks of our Illinois State Police, and these 92 cadets are helping fulfill that commitment. It's an investment in public safety that will serve the people of Illinois far into the future, long after this pandemic has passed. So to the newest members of Illinois' finest, God bless you and your families, and God bless the great state of Illinois. And thank you. I'd like to turn it over now to Dr. Duffus. Doctor.
Good afternoon. So what is contact tracing? Well, contact tracing for communicable disease is a core public health activity that has been practiced since the early 19th century. In the context of COVID-19, it is the process of following up with contacts who may have been exposed to a person with suspected or confirmed infection. Please note that local health departments have well-trained staff who utilize the principles of contact tracing daily in their work. They use it to perform partner notifications for diseases such as HIV, syphilis, and tuberculosis. And this makes our local health departments the ideal core essential partner to serve as a hub of our activity in Illinois. How does contact tracing work? Well, our governors quite clearly described how it will function in Illinois, but there are some things I wanted to emphasize. The issue of privacy. To protect patient privacy, contacts are only informed that they may have been exposed to a patient with the infection. They're not told the identity of the patient who may have exposed them. Another essential aspect of our contact tracing program is that contacts will be eligible for testing, and if that test should return negative, then they could be released from isolation. So how has Illinois conducted contact tracing to date? Well, I want to be clear that from the very beginning, local health departments have actively attempted to follow up and interview each case as soon as possible and identify all close contacts, including those from the home, healthcare exposures, and employment. Early in the pandemic, IDPH alerted local health departments as soon as tests were positive, and the local health department attempted to contact cases upon receipt of those results. The case was interviewed to determine onset and movements, and then all contacts identified from the date of onset and 48 hours prior to onset. Those deemed to be close contacts were asked to self-quarantine, and cases were isolated. Contacts are quarantined for 14 days from the date of last exposure. Contacts can choose to be actively symptom monitored by being contacted by the local health department 2 times a day, or by receiving an email or text from REDCap, which stands for Research Electronic Data Capture. The local health department can monitor compliance and presence of symptoms in REDCap. The local health department also communicates with the case and the identified contacts placed in quarantine and educate them on how to safely isolate, quarantine at home. The local health department will address any needs for provisions such as food, laundry, medication, if no one else is available to provide those services. So, as the number of cases increase over time, we have responded by developing a hub and spoke model, plan of action. The core will be the local health department, who will provide oversight, localized strategic direction, leveraging relationships with local community partners, and the spokes, for example, federally qualified health centers, community health centers, will provide deep community connections, teams of trusted messengers, and they have the ability to be very responsive. The umbrella of the hub and spoke will be the state, and the state will provide for consistency across several areas, including resources, curriculum, and technology, for example. Why is this important for the current COVID health crisis? Well, it is how we break transmission, and it's how we make sure that we don't have a large outbreak ongoing. Given the magnitude of the COVID-19 cases and plans to eventually relax mitigation efforts, such as stay-at-home orders and social distancing, communities need many trained workers. These contact tracers need to quickly locate and talk with patients, assist in arranging for patients to isolate themselves, and work with patients to identify people with whom the patients have been in close contact so the contact tracer can locate them. Fortunately, in Illinois, we're very resourced in terms of having experts to help guide us in this. So we're working with modelers from the University of Illinois, University of Chicago, and Northwestern, who have used simulation models and simple assumptions around key contact tracing parameters to approximate the daily number of caseworkers needed to perform contact tracing through the duration of shelter in place. Just to be clear, the actual number of staff needed is large and varies depending on several factors, including, but not limited to, care-seeking behavior, the daily number of cases, time from symptom onset to testing, the number of contacts identified, how quickly patients are isolated, contacts are notified and advised to stay home, self-monitor, and maintain social distance from others. And since these numbers change daily, certain assumptions are made in the calculations. So, for example, current prevalence, we assume that a staff works 5 days a week. We assume that a staff can make 20 phone calls each day. We assume that caseworkers will have 4 days over which they need to identify contacts, and this is a nearly optimal situation in which tracing begins 2 days after symptom onset, which is approximately 4 days after infectiousness. We assume each index case contacts 2 to 3 unique people per day, and this number would rapidly increase when shelter in place ends. For every positive test, there are 4 negative tests based on current cumulative test positivity rate of 23%. So the test needed is equal to the number of true symptomatic cases times 5. And this actual ratio is likely to rise once testing is further expanded. So in reference to the governor, we are using a benchmark of 30 workers per 100,000 population. Illinois has a population of 12.7 million residents approximately. So doing the math, 12.7 million divided by 100,000 gives 127. If the benchmark is 30, you multiply that out, you get 3,810 individuals as our estimate of how many individuals will be needed. However, note well that these individuals do not have to work continually because we're driving down the numbers testing positive because of the continuance or adherence to non-pharmaceutical interventions. They do not all have to be hired all at once, and so the numbers speak to the total over time. It is also very reasonable to start with an initial number, say 10% of that total, say 300 workers, but they're strategically placed in the regions that are most impacted. By working with the many individuals and institutions which I'll detail below, we will have the capability to surge as needed. Think of how we use a National Guardsman. Think of this as a dial and not a switch. Also, by deploying technology as a first contact with individuals, the number of workers needed will be fewer. We plan to implement a virtual call center, which will enhance efficiencies, and only the most hard-to-reach individuals will actually require a visit. So imagine a homeless individual, someone with no connectivity, or a very ill person. To always be on the leading edge of the pandemic, we've organized the IDPH staff into a command center of subject matter experts who are tasked with reviewing data daily and be ready to make recommendations based on chosen indicators of success, the umbrella. So who will be engaged to assist with contact tracing in Illinois? So contact tracing is a skill that can be performed by anyone who's bright, interested, and has a charming personality. We will hire people from every region of the state using mechanisms that are fast and enable quick onboarding. The core personnel for contact tracing efforts lies in 3 cadres. First, case investigators. These are the individuals, staff who reach out to individuals who soon after test results are reported as positive. Second cadre is contact tracers. They will call individuals who have been in close contact with a diagnosed case and ensure adherence to protocol and follow up as necessary. And the third cadre are resource coordinators. And these resource coordinators provide individuals on quarantine or who are isolated with the relevant resources and support to facilitate compliance with our orders. So food, medication, alternate housing, for example. So where are these people coming from? Well, we've heard from a lot of people who are interested. Professional contact tracers at local health departments, professional contact tracers from federally qualified health centers and community clinics, reassigned workers at local health departments, reassigned workers at federally qualified health centers, skilled community members such as community health workers, social service professionals, and other allied professionals. We have heard from recent graduates and students from public health training programs as well as allied health professional training programs. We have volunteers from Illinois Help who are interested, and there are also established as well as new training programs at regional training centers. To be done effectively, it requires people with standardized training and scripts, supervision, and access to social and medical support for patients and contacts. So what are some of the additional needs for contact tracing? Well, communication with the public is essential. To be successful, a community will need public awareness and understanding and acceptance of contact tracing and the need for contacts to separate themselves from others who are not exposed. Community members need to take responsibility to follow the guidance from public health agencies. Data management and technology is needed. Case investigation, contact tracing, contact follow-up and monitoring will need to be linked with timely testing, clinical services, and agile data management systems to facilitate real-time electronic transmission of laboratory and case data for public health action. And finally, ongoing monitoring and assessment of contact tracing efforts will be needed. Public health agencies and their partners will need to monitor some key components of their programs to improve performance as needed and to determine hotspots and vulnerable populations at risk. I yield to our Governor.
Thank you, Doctor, and happy to take any questions.
Governor, thank you. So how soon are they hired? How soon are they trained? How much does this cost?
I'll take the cost question, but I'd like to turn it over to Dr. Duffus to talk about how soon it can be spun up, if you don't mind, Doctor. Training and so on.
So training can take, the length of training will depend on the skills, your skill level that you're starting off. You know, some of the components of training will involve, like, say, basic computer skills, privacy and confidentiality. So you can imagine someone who's a graduate student, for example, or someone who's a retired professional, someone from a local health department. They already have many of these skills. We would just have to tailor it for the COVID pandemic. There are established training programs on pandemic training that's already ongoing. And so once we identify individuals who are ready and able to go, we can start as soon as possible. There are just other pieces that are important to put together. It's not just contact tracing that's going to help us beat this pandemic. You know, issues of testing, for example, the technology piece are also important. But fortunately, we have been discussing, and you know, we've already started thinking about some of these things and how we're going to make it equitable across the state.
Is there a target date to begin?
Well, we'd like to start at the end of the month. Right, we'd like to start at the end of the month and possibly with a soft rollout. So we're getting all the pieces that we need together and trying to uncover any potential limitations that may arise before we actually roll out.
Thank you. And then the cost, Governor?
Yep, happy to take that. So we're kind of look at what Massachusetts did as a model. They have more than 1,000 workers. They, of course, have technology which costs the same no matter really how many are on it. And so if you look at what they budgeted for it, it was about $40 million. Ours probably will be twice that. And so the guess is that this will be somewhere in the neighborhood of $80 million. We have not gotten a perfect budget yet because truly the technology solutions for this, there are several, and we're still evaluating those and deciding what the cost of that will be. And then it depends on the mix of how many people are volunteers, how many people are people that we're hiring that need more training, and how many less training, because the cost of putting someone through that training, we'll be paying them, you know, during a portion of that, and so it costs less to train somebody that already knows the job and more to train somebody that doesn't.
And the extra cost, the doubled cost, is because more workers, or what?
Yeah, exactly. It's a larger state. We have a much larger state. Yeah.
Obviously, you've seen outside, I would think, when you arrived at the Thompson. If not, there's a rather large crowd. They've been here all day. They've also been at the state capitol. Lots of frustration. Don't they have a point that some places in the state, and I have multiple questions, I could name all the people, but sure, everyone asking, why not?
Plan will take effect on Monday, and we will reopen the state. And I again want to assure Missourians that we are prepared. Throughout this week, we have talked about the 4 essential pillars of our recovery plan. We have talked about hospital capacity, which has decreased across the state with the exception of St. Louis, and our healthcare system is not overwhelmed. We have talked about PPE, and we will continue to receive and ship PPE across the state each day. In all, we have ordered almost $40 million worth of PPE and have already shipped almost 2 million pieces of PPE to our local partners, including almost 300,000 N95 respiratory masks. 450,000 face shields, and 200,000 surgical masks. We have talked about the data, and our data shows that the number of new positive cases have decreased steadily for Missouri overall. Especially promising is the decline of cases in rural counties where we have also had concerns over hotspots. The overall trends show that we have met the 4 pillars and that we are ready to safely open Missouri. As Monday approaches, I know many people are excited, but I want to remind everyone that this is not the flip of a switch. The coronavirus is not gone, and we must continue to be proactive and maintain social distancing to protect not only ourselves, but everyone around us. That said, we encourage Missourians to safely re-engage in the economy. Now more than ever, our Missouri businesses need our support. And it is important to remember to buy Missouri and support your local businesses. I know that a lot of people have shopped online since the coronavirus has taken place. But if there's ever a time in our history and of our state, now is the time that we need to make the special effort to make sure and do business with our local businesses across the state of Missouri. It is critical to get our economy going, and it is so important for us to support one another in this state. Today, I have Director Chen with the Department of Agriculture here. I also have Commissioner Steelman with the Office of Administration here to give some updates today. Also, Director Parson is here, and Director Williams is also here to answer your questions. But first, I'm going to start with Director Chen to give us a little update on the agriculture. Director?
Thank you, Governor Parson. I want to share some updates on our department's effort to keep our food supply moving. And truthfully, it's not just our department's effort, but it's the efforts of all of those across the food supply chain. Our agriculture organizations, our grocery stores, our food processors, our food banks, and of course, our farmers and ranchers. Every part of our food supply has been pressure tested since the beginning of the COVID-19 pandemic. Agriculture production is often impacted by natural disasters like the 2018 drought and the 2019 flood. But these events rarely impact food choice. Even during the COVID-19 pandemic, consumers have seen little impact in the grocery store because of our sophisticated food system. As farmers and ranchers, we take a lot of pride in raising food that will one day end up on your family's table. COVID-19 has presented tremendous market disruptions across all sectors of the economy, and the food supply chain is not immune. Our food supply is designed to provide fresh food for your table. That transition from farm to fork is very quick. Much of the food supply depends on a just-in-time delivery system. For some agriculture products, we are experiencing bottlenecks with processing raw farm products into the items that you see in the grocery store. A lot of work goes into bottling milk or preparing a package of steaks or pork chops. As food processing businesses slow down production or sometimes close due to COVID-19, there will inevitably be market disruptions, and those impacts are often first felt on the farm. When farmers have trouble getting that product to our consumers for any reason, it's very hard on them. In the last several weeks, we know consumers have seen information online and in the news that we would like to address. You've seen a lot about milk dumping. Due to rapidly changing demand, seasonal oversupply, and processing bottlenecks, some farmers had to dump milk before it could be processed. As of early April, Missouri farmers were no longer dumping their milk. You may have also heard about food shortages. We don't expect widespread food shortages at this time. However, you may see localized shortages of certain protein cuts or increased prices for some items. I'd like to directly address the importance of our protein processing plants throughout the United States. In March, the U.S. Department of Homeland Security listed food and agriculture as critical infrastructure. On Wednesday, the President invoked the Defense Production Act to compel processors to remain open. Together, these actions show that providing food for our families is a critical need. Recently, the public information surrounding our meat processors has been negative. As a farmer myself, there are a few things that I want consumers to understand about these processors and their team members that work with them. 1, they are proactive members of our local communities. Their workers and their leadership live and work in the same communities that we live in. Oftentimes, these processors are engaged in community service projects that help with the efforts of COVID-19. 2, we at the Department of Agriculture have been in constant communication with our protein processors throughout this entire pandemic. They have been working to protect their teams by using social distancing measures where possible. They've been screening their employees for symptoms of illnesses. They've staggered start times. They've staggered break times. Their number one priority has always been to care for their team and to protect them. As a cabinet, we've helped them find face coverings and implemented comprehensive testing in their plants. 3, protein processors are modern, high-tech facilities that are highly regulated for cleaning and sanitation. 4, these team members who process our protein are highly skilled. They have very important technical roles in keeping all of our families fed. And 5, there are protein processors of all sizes, from major companies all the way down to small mom-and-pop businesses in the state of Missouri. They all matter. They mattered before COVID-19, and they matter today. Keeping our processors operating safely is a matter of national and statewide importance. These facilities and the safety of their teams will be a focus for my team. It's crucial for our farmers and ranchers, it's crucial for our economy, and it's crucial for your families as well. The comprehensive testing that's happening at Triumph Foods is positive news, and it aligns with the governor's Show Me Recovery plan. Thanks to this plan, we have expanded testing capacity, and we are identifying team members that aren't showing symptoms but who test positive for the virus so they can isolate in line with CDC guidelines. If you see a team member in your community who works at one of these processing facilities, no matter if they're large or small, I encourage you to thank them. They have been on the front lines of this COVID-19 pandemic. They are the unsung heroes. They are ensuring that the food that our farmers in the state of Missouri raise will reach your table. These men and women play an important role in our nation's food security, just as our farmers and ranchers do. And finally, I'd like to speak directly to our farmers and ranchers. I know the pride that you take in your work, and the past few weeks have not been easy, especially if you have livestock that's ready to go to market. Agriculture is used to facing challenges. The challenges brought on by COVID-19 has impacted agriculture in very unpredictable ways. I know firsthand what life on the farm has been like for all of you for the last 6 weeks. The decisions that you are making today will shape the future of Missouri agriculture. I know that weighs heavy on you. I know that you go to bed each night hoping that tomorrow will be the day the markets recover, or that tomorrow will be the day that you get to work your land. We will weather this storm together, as we always do in agriculture, as one team. And we will continue to support each other and our rural communities, because that's what we do in agriculture. Thank you.
Chris, thank you, and thank you for what you're doing for the Department of Agriculture. I also just want to thank, today I want to thank all the farmers, the ranchers, producers in the state of Missouri for the job they do every day. While, yes, some of us were under a stay-at-home order, those farmers every day went out to those fields, they planted those crops, they took care of their livestock, and they do what they do every day on the farm to make sure tomorrow and the next month and the next year we're going to be able to buy groceries for our families and to have food on our tables. And I just want to thank them personally for what they've been doing during this whole virus situation. Also today, Commissioner Steelman is here with us today to give a little update on the state employees and the state situation. So, Sarah.
Thank you, Governor Parson, and thank you, Director Chen, for all that you're doing to protect agriculture. The Show Me Strong recovery for state government means that we will be opening some of our state office buildings to the public. But just to be clear, our state workforce never stopped providing services. When Governor Parson issued his stay-at-home order in March, we took action to get as many employees working remotely as possible. So as of today, 14,930 teammates are working remotely. That is almost 40% of the workforce. And 21,771 are actually physically present at work. That includes our direct care workers, our correction guards, our nurses, our caseworkers, and our maintenance teammates who are located in our institutions throughout the state. Thank you for your service. There are 3,915 team members that cannot report for work or are on administrative leave or unavailable to work for other reasons. We've also been keeping track of how the citizens have been impacted, and I'm pleased to report that we are performing at about 94% of our normal capacity, and that percentage includes just a little measure of the diminished services that have had to be reduced or delayed. So please know that state government has continued to operate. We continue to encourage the public who has business with the state to do so online or by phone or by mail. I am grateful to our workforce for their commitment to public service. Many have worked long hours and weekends for the last 6 weeks to ensure that people are being helped. It is truly remarkable. Beginning Monday, consistent with the governor's Show Me Strong recovery order, we will be reopening major office buildings throughout the state to the public. Each department will be responsible for deciding which offices to open based on their unique circumstances. Major office buildings are defined as 300 or more staff in those buildings. The National Guard has agreed to help us with screening our employees and the public as they come into the buildings. So a big thank you to the Guardsmen for your service and your help. We will be asking our employees the symptom questions, and if they answer yes, then they will be asked to return home and contact their physician. The Guard will be advising the public that if they have any of the symptoms, that they may not enter the building. We will also be social distancing and limiting the number of individuals in the reception areas that are open to the public. We will continue to social distance our employees throughout all of our buildings and to clean and sanitize the workspaces each day. The number of state teammates actually returning to work on Monday is 2,256. Some of the services that will be open in the office buildings include motor vehicle and driver's license, the Bureau of Vital Records, motor vehicle inspection services, and driver's tests are open throughout the state. Department of Social Services continues to provide their assistance online, by phone, and by appointment. Again, a big shout out to all of our great state employees who have worked so hard to serve and help the public during this time. Thank you.
Thank you, Sarah. Thanks for all the work you're doing, and thanks to all the state employees for doing their jobs day in and day out, and for all the people that were there, whether you was in the special needs side of it, again, like Sarah said, nurses, our correction personnel, our public safety personnel, and on down. I want to thank you all for being at work every day and continuing to support the people of Missouri. In closing today, I know many people are excited for Monday. Others might still be nervous and uneasy. Again, just because we are reopening does not mean things will go back to normal right away. We are on the road to recovery, but we must be proactive and continue taking steps to protect ourselves and others around us. The most important way you can do this is by following the social distance guidelines. Remain 6 feet in distance between yourself and others. avoid large crowds and gatherings, practice proper hygiene, and stay home if you are sick. We look forward to Monday, so please be safe, be smart, and be responsible. Thank you, and God bless. Kelly, want to open it up for questions?
Hi, Director. I was just wondering, the USDA said they will be supplying meat processing plants with protective gear for workers, and I know you kind of mentioned that, but is the State Department helping out in any way?
We've been in contact with all of our processors on a weekly basis, sometimes daily, to make sure that their needs are met on that. When they had a challenge trying to source the PPE, we were connecting them to the suppliers that were out there to try and help them make sure that their employees were protected.
Do meat producers or processors in Missouri need some extra money added to the state budget to help them out?
You know, that's a question that really they need to answer, but I do know that their cost of production has increased with all of the extra protections that they put in place for their team members. They've put in a lot of plexiglass, they've increased the sanitation, which was already a very high standard. They've also staggered start and stop times. They've had to purchase a lot of screening equipment as well. So I'm sure that their cost of production has gone up, but I cannot speak directly to how much or what volume that is at.
Just to follow, is that something the department is recommending to the legislature as this goes along or not?
I think you're referring to what happened on the Senate floor today with increased money, and we were just made aware of that a couple hours ago ourselves. So we need to look into that more to find out exactly what the purpose of that is and what we're going to do. And it's still yet to be seen if it's ever going to make it out of conference as well. So we're going to be watching it, trying to learn what we can about it. And if you'd like to follow up with our department later next week, we'd be happy to discuss it more.
Yes.
Director Williams, I asked earlier this week about the nursing home transparency. Where can we find that information?
Hopefully it's already up on the website, and what that will consist of, just to be clear, because I did want to follow up with you on that today, is that it will list by county the number of long-term care facilities and prisons and jails that have more than 2 cases in them ongoing. We're prohibited by law to name the facility at the state level, but you will know within those counties, by county, the number of facilities, and then you can follow up with the local health department, and they have different rules and regulations on that than we do as a state. But we very much appreciate your suggestion, and we've looked around the country, and we think that's a reasonable thing to do.
Why the 2 cases? Why that number?
Because that's what we technically consider to be, and that's kind of around the country, an outbreak is 2 cases. That's kind of within the national public health nomenclature.
And what is your department doing to help facilities meet the new federal requirements to inform family about cases among residents?
Yeah, just making sure that, especially with our local health departments, they follow up on that. That is a federal regulation. You know, we regulate those homes through our Department of Regulation and Licensure, so we are making sure that they comply with that. Thank you.
Hi, Dr. Williams.
Yes.
What might have caused the positive? There was a little bit of a jump in the cases today. So what do you think might have been the cause of that?
Yeah, you're gracious to ask that. And again, you may have seen the press release we put out today about 12:30. We have 167 more cases in Buchanan County. We tested 916 people on Tuesday and had 167 come back positive. We have, so that accounts, the 92 yesterday, the 167 today are going to bump us up. Now, again, it's one of the problems with looking at that. Those are all asymptomatic patients, so that's a different really grouped than what you normally see in that number. And this is part of our boxing in strategy. We have 709 more tests pending, and they'll be coming in tomorrow. So there'll be some more. Right now we're running about a 13% positivity rate up in Buchanan. And then anybody hasn't been tested, we're at about 2,400 tests of 2,800 employees. We'll be testing them on Monday and Tuesday in the Northwest Health Services parking lot. So really appreciate you asking that question, because that's why you see that bump. As you know, we've trended down now for several days around 160, 120, and that's very consistent with our what's called our R0. Our doubling time is now 23, 24 days. So that curve is very much going down. Yes,
sorry.
no,
And a follow-up. Do you fear that the community sampling events like this one in the Buchanan County will show infections that you thought were worse than you thought?
Well, I think what you're going to see with our testing is you're going to see more tests, but more people are going to be asymptomatic. We have a tranche. We did 4,000 tests this week looking at community snapshots, third ward of Kansas City, down in the Boot Hill where we hadn't done some testing. So, for instance, by tomorrow we'll have 4,000 more tests, but you got to remember those are largely asymptomatic. So when you factor those in, if you compare those to tests from 3 weeks ago, which were mostly people who were symptomatic, it's really comparing apples and oranges. So try to keep the situational awareness or context in mind. And I think the best advice I can always give people is the governor's, which is don't look at a single day, look at trend lines.
Definitely. And then what other community sampling events are taking place right now? And do you know any of the results of them right now?
Well, we have 4 community sampling. Now, there's a difference between the boxed-in strategy, which we've done in one prison, in one nursing home, and up in Buchanan County. In the community snapshots, we've done 8. I can tell you, for instance, we did it in Phelps County on Sunday, and I think we did 400 tests of just having people come in randomly, and all 400 were negative. And so tomorrow morning at 9 o'clock, I get the other 3,600 tests from the other 7 sites, and we'll certainly share those with you.
Sweet. And sorry, I have just one more question. We have some viewers asking if there is any recommendation on how long people with compromised immune systems, health issues, and like the older populations, should they stay home as the state is starting to reopen on Monday? Is there any guidance on when they may be able to get out?
No, I mean, I think that they can get out on Monday as long as they practice situational awareness. You know, the governor has said, you know, my mother and others have been confined for 6 weeks, 7 weeks. And so, you know, I think on Monday, if my mom wanted to be with her great-grandchild, that would be a reasonable thing to do. Now, I think that would be different than going to a crowded place or to get on a bus, for instance, where she's going to be right next to somebody. So I don't think we have any special stipulation on Monday for different groups other than again, just to practice situational awareness. But I imagine there are a lot of, I think I have one behind me, a grandparent who really want to be with their grandchildren, and especially if they've been confined for 7 weeks. And so we certainly understand that. We just ask them to use social distancing and situational awareness. But thanks for thinking of them.
Dr. Williams, maybe a silly question, but a small business owner asked me, and I didn't know the answer. When they do begin to open up, and let's say they have a positive case, will the state be sending out teams for contact tracing, or would they be somehow responsible for that?
No, Jacqueline, it's not a silly question at all. Thank you for asking. No, if any business has one single case, we're not going to box in that business, obviously. But yeah, it's reportable by law, both serological testing and the nasal swab. And it's reported within 24 hours, and then we go out and do contact tracing even for that one case. So that's a good question. Thank you.
All right, Governor Parson? Any questions for Governor Parson?
Governor Parson, a lot of stores are still facing shortages on disinfectant wipes and sprays. When we reopen on Monday, how do you propose that businesses follow CDC guidelines while we're still facing that shortage of cleaning supplies?
Well, I'm not for sure that information you have, maybe that's out there somewhere, but I haven't heard that from the retail or the grocery stores, or have not heard that officially yet, and we're in contact with them, so that may very well be. I would hope by now people are stocked up on that, has a few supplies on that to be able to handle that. Again, I think that's going to go back to the personal responsibility of the individual. I know for myself personally, you know, at home and my kids, most of them by now have that hand sanitizer and those wipes as much as possible. But I'm not aware that there was a shortage of that. I know there's a lot of people stepped up for the hand sanitizer, that sanitizer stuff. So I hope that's out there. But if not, we just need to know about it and see if there's ways we maybe can get people connected to our manufacturing businesses in the state.
Governor, earlier this afternoon, a group of supporters turned in 350,000 signatures for Medicaid expansion to put that on the ballot in November. They said that with the coronavirus, it's even more important to expand Medicaid coverage for low-income adults. What's your reaction to that?
Well, first of all, Medicaid is going to expand, whether you pass that or not, simply because of the regulatory environment we're on right now, because more people are going to go on Medicaid in the state of Missouri just because the unemployment numbers are so high. And without any restrictions right now, that number is going to grow. So Medicaid is going to grow whether you pass that or not right now, or do an expansion to it here in the state. You know, as far as what it does at the ballot, you know, I don't know what that'll do when it gets there. That'll all be through the political arena. We'll see what happens if that's what's saying. But right now, the Medicaid rolls are going to expand in the state of Missouri just because there's more people that qualifies to be on it.
Right. This is talking about expanding eligibility. I think earlier this year, you had expressed opposition to that idea, said it could amount to a tax increase. I'm wondering if you still are opposed to that, or if for some reason the coronavirus has changed your thinking about that ballot measure.
Look, I don't think it's a time to be expanding anything in the state of Missouri right now. I'm telling you, we're going to have challenges going into 2021 for sure when it comes to just meeting the budget with what we currently have. But there's absolutely not going to be any extra money whatsoever. As a matter of fact, we're going to have to make some tough decisions in the near future, just to even think about balancing the budget.
Yeah, Governor, as Missourians go into this last weekend of the stay-at-home order, what's your message to them?
You know, I think just be cautious. Use common sense. Look, the one thing I want everybody to know, make sure you know what your risk is as an individual. You know, if you're somebody that's elderly, you need to know that you're in a little bit higher risk category than somebody that's young. If you have underlying health issues, then you're definitely a little higher risk. So you just need to use a little common sense as we go out, as we meet that. But, you know, people's got to get back out. We got to get the economy going, but we can do it safely, and I think people will gradually be coming back out. I just don't think there's going to be a rush for everybody to go out on Monday morning and hit every business in the state or anything. I do know, however, me and the First Lady will be out. On Monday, we're going to be making a few stops around the state for the first time in probably 60 days. That we'll be traveling some just to kind of go out and see what those businesses are doing and see what challenges they have and what they have been doing for the 60 days. So.
Governor, I'm relaying a question from another reporter here. This reporter is interested in elections and was wondering if you were open to the concept of a compromise, I guess, of expanding absentee voting to include no excuse absentee voting when paired with a requirement for a photo ID.
Well, first of all, no excuse. I would be open to that to a certain degree. You know, again, I'm not going to get in the ballot issue. The Secretary of State's working on that. I know, and some of my staff's been talking to him and the county clerks. So we got to figure out, especially for the June elections, what are we going to do to make sure people give them opportunity to go to vote and that they can do it safely. So I think we're all trying to work on that, and I understand we're under a strict timeline here to make decisions on that. But again, when it comes to no excuse absentees, you know, I'm probably much more lenient to that than I would be changing many other regulations of the voting law. Again, we've been at this for 50 days, and I think to start making decisions for next year's elections or for November's elections, I think we're too early to do that right now. All right, thanks everybody for being here today. Have a good weekend. Thank you.